Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Today's topic on Health Talk: venous reflux disease, varicose veins, and the treatment of them, with Dr. Bill Burns. He's a surgeon on staff at Mon General Hospital, and with High School King, Burns, and Tallman. Welcome to the program today.
Good morning.
I'm Jim Stallings, along with co-host Kay Murray. Good morning, Kay.
Good morning, James. My first question, do men get varicose veins?
Yes.
Oh, see, I thought it was all up to women.
It's more women, but about 40% of men can get it.
Well, thank goodness.
You just don't notice it on men because not all of us wear dresses. You know, so when you wear a dress, it's probably
Some
more
of you don't.
exposed, at least in the legs or something to that effect. What is venous reflux disease?
Venous reflux disease is a backflow of the veins. Veins are supposed to carry blood from a distance away, a point away from your heart towards the heart. Arteries carry the blood to the organs. Veins carry it back. And the veins are composed of a network of almost like the locks and dams of our river to help get the blood to go against gravity. There's a set system where the valves will close, and with the help of the muscles and activity, the blood's going to flow back up towards the heart, especially in the legs. You're going against gravity, which is the worst place, and you see the varicose veins. People can have them in other places, and they have other names in other places, but typically the venous reflux disease that we deal with and what we can do with these minimally invasive techniques of today are composed of just working on the legs.
What are the symptoms of venous reflux disease?
Well, it's based on what happens. The valves, where they usually come together closely and tight, they tend to lose their ability and they become weak and they leak. And then the veins will dilate, and that adds to the problem. The symptoms that you see are obviously varicose veins, but you also can have people that have no visible veins that have significant swelling, pain. Their legs feel tired. Everybody stood up for 10 or 12 hours and gone home and put their legs up and just breathed a sigh of relief. Most people can get relief by elevation, but some don't. The end stage disease is when you see ulcers or wounds that won't heal because of the chronic pressure and swelling and edema.
If you're on your feet all day, is that a complication? Are you having blood pool down there in any way?
It's much more common in people that stand. Your people that are factory workers, teachers, doctors, nurses, people that are standing all the time. It's just more work for the legs, and you'll see that in these workers. But there's other causes and etiologies besides just standing that cause it.
Knowing that and knowing that you're in a profession where you're standing all the time, is there something you could do to prevent it?
Yeah, and that's part of the conservative treatment. That would be wearing compression hose, which are very tight hose to degrees to help compress the calf so that there's not pooling and that edema and swelling and things like that. And to elevate your legs. Walking, exercising helps as well. If you can move around, that gets the muscles to contract, and that causes to push the blood out of the leg a little bit better.
Why 72% of women and only 40% men?
I'm not really sure about that, but they think it's associated with women having pregnancies. If the more pregnancies you have, the more common it is. The classic thing I hear is that the women that come in, they name their varicose vein after the child that they had during that pregnancy. So that's part of it. Their body physiologically, when they're pregnant, there's a lot of pressure in the pelvis, and it decreases the outflow of the legs. So that's part of it. For some reason, it's genetic too. You'll see family members that it goes through. Grandma had it, mom had it, I have it. But I think the data is 40% of men, but it seems like I see a few more than that.
Wow.
And typically the men have much more dramatic disease because they don't want to seek attention.
Does lifestyle have anything to do with this? Our weight, exercise, does that play into?
Yes, being overweight or obese adds to it. It makes more work for the legs. You're carrying more weight. It's more gravity induced. Lifestyle. If you don't get up and move around, you're not going to have those muscles contracting at a more efficient rate when you're walking. If you stand all day and you come home and you just go to bed and you don't elevate the legs, it makes it worse.
What about family history?
Yeah, it's big. I mean, that's what I was saying. You see these families that go through that that they have it. Mom, dad, grandma, everybody has it. It's significant for genetics.
So if we have a family history, we're obese, and we've had multiple pregnancies, we're going to have the problem.
Yeah, but there's a solution. That's the good thing now.
There is. Well, hold off on that. Maybe that's a reason to stay tuned for the next segment. Matter of fact, I know it is. We'll talk about some solutions. We'll talk about treatments. We'll talk about diagnosis as well when we come back from the break with Dr. Bill Burns, and he's with High School King Burns and Tallman, and also on staff with Mon General Hospital. Your phone calls are welcome. If you have any questions about varicose veins, about venous reflux disease, 304-296-0041.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Welcome back to the program, Health Talk, brought to you by Mon General Hospital. Our topic today is venous reflux disease, varicose veins, and we're going to be talking about treatment. You mentioned compression stockings. It just doesn't sound very fashionable. They make a fashionable compression stockings?
You'd be surprised, actually. Nowadays, they actually look like men's dress socks, like a black or a brown.
It's going to look great on a woman.
Well, no, they have women that have hose colors, and they don't look like grandma's compression hose that were really thick and look like some type of embroidered material. And they actually are more comfortable now, and they've worked on them a lot. It's like everything else. It's come around. The initial treatment is conservative treatment, which would be wearing those compression hose, elevating your legs when you can, trying to exercise, trying to get your weight down, all the things that are easy to say but hard to do.
But the compression stockings don't really cure the problem, do they?
They don't cure the problem, but they make it a lot better. There's people that wear them prophylactically, as far as nurses and stuff. That's the biggest users of those that don't even have varicose veins, because by the time they go home after a 12-hour shift, they take them off and their legs aren't killing them. So it helps. People that have ulcers and things like that, it's difficult for them to do that. But if they have big varicose veins, they can get by through the day with wearing them.
So they just start wearing them and keep wearing them? Just part of our regular ensemble every day?
It is. And most people that do it, they last 6 to 8 months, and they usually get a couple pairs of them. They rotate them and do things like that. They're expensive, but they're worth the money. And prior to doing any type of surgical intervention or any of this minimally invasive intervention, you have to wear them first. You have to prove that you've gone through the treatment.
So that's a conservative treatment. Now, when it comes to ablation treatment, I think of ablation as obliteration, but that's probably not right.
Well, in medicine, it's not quite that. We're not allowed to do that. But ablation just means to close or to stop. Or to disconnect, basically. And it's a lot of this technology started in cardiac procedures and catheterizations, and everybody knows about getting heart stents and things like that. And there's electrophysiology things where they go in and they stop the rhythms and things like that. That's where the ablation technology came from. And then somebody decided, this was based on the old treatment for varicose veins, was to do what we call stripping. And you'd put a catheter into the vein, and you go from one end of the leg up to the other where it connects to the deep system, and you would disconnect it from the deep system, and then you would pull this catheter back with some type of sideways, almost like a board effect. And when you pull it, you'd rip the entire vein out. Well, there's a lot of collateral branches. There was a lot of bleeding, a lot of bruising. It was pretty brutal. People had to be put to sleep. And a lot of people actually got to the point where they wouldn't do that. They just lived with the veins because the treatment was worse than the problem. Nowadays, somebody figured it out. If we put a catheter in there, just like we do an IV, then you got to figure out a way that you can close the vein down. And they came up originally with laser treatment, which is just heat. And then somebody got smart and decided to use radio frequency energy, which is just like microwaves.
So it's interesting, you just close the vein down. So it must not be like a major vein or a major artery. I mean, it's another way for the blood to get delivered.
Yeah, there's a deep system in the inside of the leg, and you have to have that to be okay. And you have to have an ultrasound before you can do any of these treatments to make sure that you're not going to do something that's detrimental to the patient. And then the way it closes it, and I explain it to people, it's sort of like the long wall in the mine. When they pull everything out, everything drops. And it closes that entire space. When you put the catheter in, you turn on the machine, and when it turns it on, it basically cooks the vein from the inside. That vein's doing you no good. All the blood's going in the wrong direction, and it's dilated. It's like a large tree trunk. So you're closing that down, and then the varicose veins are the limbs. They can't get that blood flow to them when you stand up, and they don't fill and gorge and look like cigars going down somebody's leg.
So if you've closed down a vein in my leg today, it's just a same-day treatment type of thing?
We do. It's in office. It requires local anesthesia. We usually give people a little bit of sedation, some type of benzodiazepine drug, like a Valium-type drug people take. And then it's under local. We use the ultrasound machines that we have right in our office because we have an accredited vascular lab in our office. So we were the ideal location to do these. And then with the ultrasound guidance, we go ahead and put an IV in, just like they do for a heart catheterization, into the vein.
And so, is there a warranty with this? I mean, is the body going to say, "Oh, you're going to shut down this vein, then I'm going to reverse the blood flow in this vein over here," like 6 months from now?
Actually, that does happen, and I tell people that this is the main vein, and in about 95% of people, this is what works well, and it's simply done, and it causes no real problems for them long term. But there are people that another vein will open up on the other end. It's sort of like the groundhog. He has 2 holes. Sometimes he'll start coming out the back door and it'll get enlarged, and then we do some type of treatment. We have other modalities that we can do later on.
So far you've used lock and dam as a reference. You've used that one there. Was pretty good. Yeah.
Well, I'm from Fairmont, I talk the talk. So.
Making us understand it. Is this cosmetic? Will our insurance take care of it?
The insurance will not take care of it if you don't meet specific guidelines. And
will you see that I meet those guidelines?
Yes, ma'am. You have to fail conservative treatment. You have to have veins that are dilated, and you have to have documented reflux, which is all done with the ultrasound that we provide prior to doing any intervention. Then we have to pre-certify it through the insurance. And actually, the insurances are getting much better about this because they realize that we're going to stop some bad problems. People get venous stasis ulcers. They're very difficult to treat, and they cause a lot of problems, and people go to wound care centers for months to years to try and heal these things. And once this treatment came out, it's actually helped a lot too. Chronic wounds are very expensive, and they cost the taxpayers and these insurance companies a lot of money. So if somebody has reasonable amount of disease and you can document that, the insurance company will pay for it.
If we ignore it and just let them grow or let them get worse, will it lead to more difficult problems in the future?
Yeah, I mean, the cosmetic part is obviously a big portion of it, but people can get clots in these veins, and that's called phlebitis, and it can be very painful. They can develop clots that propagate up almost into the deep system, and they can get a deep venous thrombosis, or they can throw one of the clots like a torpedo to their lungs, which is a pulmonary embolism, which can be fatal. I'm not trying to scare people, but these things do happen.
Like long airplane rides, I hear people have.
Yeah, and not just because they have the varicose veins, it starts that, but that can be an initiation of the process.
I remember when, of course. High School Kings Burns and Tallman advertised with us a few years back about this venous closure procedure, or I think it's called venous, a VNUS.
VNUS.
Must have been like a really breakthrough or something to go and advertise to the community. We have this treatment right now. That must have been pretty cool at that time.
Yeah.
So is it relatively new?
It's been out for about 9 years, but the catheters have gotten better. They have what's called a quick closure catheter now, and it takes 2 to 3 minutes once you get the procedure and everything lined up to close the vessel. It's within 2 minutes it's done. There are 2 different modalities, and I want to let you guys know this. Some people use a laser to do this. The laser requires more time to do the same treatment. It's not as efficient, the heat that it delivers, and it delivers so much heat over a long period of time that it can damage the vessel and outside of the vessel, and people can actually get burns on the skin associated with the laser. Most vein societies now in the literature recommend using this radio frequency energy, which, like I said before, is like a microwave. It heats up from the inside out, and it causes the water molecules to vibrate. It's very efficient. You turn on the machine, and it takes 15 seconds to burn the vessel and achieve a temperature of 380 degrees.
Those vein societies, do they have conventions and things like that?
Yeah, they do, actually.
A lot of mirrors on the wall because they're so vain. Yeah. 851, you're listening to Health Talk, brought to you by Mon General. And I just want to clarify here, we're talking about venous reflux disease. Varicose veins, is that just a result of that disease, or varicose vein? I mean, are we talking about 2 separate things here, or the same thing?
The venous insufficiency is the beginning of the disease. What happens is once they dilate and those valves can't close, the blood's not going to go up, and it's got to pool somewhere. And what it does is it starts pulling in these smaller veins, which dilate over time to help have storage capacity to hold it. The legs swell. Not everybody gets the varicose vein. Some people just get swelling of the legs. The tissue, when you push your finger on your leg after you've been standing for 12 hours, you can see the indention. Those are signs that the fluid's not getting out of your leg efficiently.
So if a portion of our leg looks like a Google map, does that cause concern? I mean, there's a lot of little roadways and blood vessels that are discolored.
There's lots of veins that are in your body that you don't see. they're just not very big. And so once they dilate, then it becomes more of an issue.
If you have any questions, pick up the phone and give us a call. We're learning about varicose vein treatment this morning and venous reflux disease. 304-296-0041. Back with Bill Burns right after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
You're so vain. You probably think this song is about.
Yes, Dr. Burns, it's all about you.
Yeah, thanks.
And again, we were talking about varicose veins, venous reflux disease. Basically, your blood doesn't know where it needs to go when it's down in your legs furthest from your heart.
I want to ask about knowing who's going to do the procedure, getting to know the individual. How important is that before we just go in and have it done with somebody?
I think that's big for anything. This is an interventional procedure. You're putting something inside somebody's body. I think you got to know what you're doing. And if there's complications or problems, they got to know how to handle it. It's like anything else. You want a professional doing it. And we do surgery at our office. We do vascular surgery. We specialize in these things. So I think that is a big deal. And to know what you can do and not do, and give people an honest answer before you start doing these procedures, I think is very important.
So going to a surgeon is important.
Well, I would say
if
that.
something would go wrong, at least you're there.
Exactly, and maybe they're not going to try to do something just for money. I mean, obviously there's people that do that, I guess, but
There's people that do this that aren't surgeons?
yeah, you don't have to have any certification to do this.
Oh,
There's
man.
family practice docs. There's allied health assistants, physician's assistants, nurse practitioners, and not around here, I guess, but in other places, there's anybody does it.
I could set up in a van and go around.
You could set this up at the mall if you wanted. There's nobody to regulate it.
At High School King, Burns, and Tallman, do you offer screenings of any type?
Yes.
If we're just having some leg problems, we don't feel real good?
Free screenings all the time. All that people have to do is call 304-598-2200 and just ask for the free screening. We'll tell you if you're a candidate right then and there. It usually takes about 10 minutes. It can be scheduled. You don't have to wait. We have plenty of slots to do that. And then if you meet criteria and you want to talk to somebody about it, there's always somebody available. We can give you literature. We can do whatever you want.
Michelle, you're on the air with Dr. Burns. Go right ahead.
Good morning. Spider vein treatment, the dark veins that are on the surface of the skin for a fair-skinned person, is the procedure the same as the previous varicose vein treatment?
Unfortunately not. The spider veins, as you can see when you look down, they're very small. They're tiny. And these are catheter-based interventions where you're going to affect the larger veins. Now, some people have spider veins associated with the varicose veins, and when you close off that flow to the leg, they blanch, they get lighter. But most treatment for spider veins now is the local treatment, either with what's called sclerotherapy, which is an injection, or with some type of laser light treatment, sort of like what they do for hair removal and things like that. And they're not real effective, but they do work, and they do decrease the severity of them. And we chose not to do that type of thing since we are surgeons. I'm not really a plastic surgeon, and I don't want to be a dermatologist, and I kind of leave that up to those guys. So I usually refer anybody that doesn't have significant large vessel disease to one of those colleagues. If they have the large vessel disease, then I usually treat it first, and that's what we've actually got the dermatologists and people sending that stuff to us because they want us to do the most bang for their buck first.
Thank you, Michelle. And, of course, your office, High School King, Burns, and Tallman, located above the Suncrest Town Center, above where the Damon's was and soon to be the Tilted Kilt. And what is your contact information up there if we want to learn more about treatment?
Or for a screening?
Well, we're on the web at hkbtsa.com. So it's our initials, Surgical Associates at the end.
And 10 seconds, a phone number?
598-2200.
All right. Thank you so much, Doctor.
Thank you very much.
Appreciate it. Dr. Bill Burns, our guest on Health Talk, brought to you by Mon General.